Now, for caregivers or relatives who watch the progression of a disease called frontotemporal dementia, or FTD, in a family member, it can feel like a stranger has moved into the household. And FTD can often be misdiagnosed because it's so rare. But today, we are discussing this form of dementia with Deb, who is a caregiver for someone with FTD, and dementia expert, Dr. Tiffany Chow. Hi, thank you so much to both of you for being here.
Hi, Ashley.
Now, Dr. Chow, what are some of the signs of FTD? I know we've said how rare it can be. You know, how is it different than Alzheimer's?
Frontotemporal dementia is named that because it affects the front half of the brain, which doesn't manage memory, and memory is the main loss for Alzheimer's disease. Frontotemporal dementia shows a loss in your ability to project a consistent personality out to other people, and that is shaped by decisions you make, things that motivate you, the way you communicate. When you lose those skills as a 50-year-old or someone even younger than 50, people would be surprised that the word dementia comes up in the conversation. So there's a tendency to misdiagnose as a midlife crisis or depression, but this is not something that responds to antidepressants. It keeps getting worse over time, and families get worried because they know there's something different going on.
Wow. Yeah, and Deb, like we just said, can you tell us your experience, because you are actually caring for a loved one with FTD?
Yes, our experience started at a very young age. My husband was 38 years old when we started seeing signs of FTD. We own and operated an automobile repair business with 2 young kids at home. We noticed some signs of just lack of motivation, paranoid episodes, and also just like lack of empathy. It took many years of doctoring and meds and those types of things. And finally, we did get a diagnosis at the age of 44. And at this point, it was to the point that he could no longer live with us by the time we got the diagnosis because of the paranoia and the delusions and the behaviors. And so we had to put him into a nursing home. And it is so devastating for a young family. I was 40, still working full time, and my daughter's a high school. She's a senior in high school, having to have her daddy put into a nursing home because we couldn't care for him. We couldn't get any home agencies to help us for any help because of insurance companies didn't even know about FTD.
Yeah.
So that's where we were at.
And Dr. Chow, what are some of the reasons why a person may consider getting genetic testing for FTD?
Well, on top of the huge impact that this has on a family financially, socially, there are a high proportion of patients with dementia due to FTD who have gotten it through a genetic mutation. That is to say that there is a genetic code that can be inherited by future generations. So most specialists who diagnose FTD will also at some point talk to the family about getting genetic counseling to decide whether it's right for them to understand the genetics of the disease for their family, and then they do the testing.
And besides the genetic testing, what other research is being done to really help people with this?
There are multiple types of research ongoing. Some of them have to do with watching and recording how the symptoms correlate with different aspects of brain chemistry. And some of that research is giving us clues as to what kind of therapies might be most beneficial for patients with FTD. There are other lines of research that are actually clinical trials trying to see what could be effective, because right now there is no FDA-approved therapy specifically for FTD.
Wow. Now, Deb, can you tell me one thing before we get out of here, one thing that you want caregivers and people just in general to know about living with FTD?
I would say don't be afraid of science. We chose right away when Tommy was diagnosed that we needed to do genetic testing. And I would say go to our website, learnftd.com. There is a wealth of information on there, and educate yourself and look at what opportunities there are and just learn and just figure out what route you want to go down if you feel as if FTD is in your family.
I think that's such an important message, and I thank both of you so much for being here and getting the word out about this. Thank you so much.
Thanks, Ashley.